अस्सलाम वालेकुम। उम्मीद रखता हूँ खैरियत से होंगे। फिर ये तो ना कहे ना कि फेल हो गए। आज आप लोगों के लिए लाए हूँ स्पेशल 30 MCQs। इसको गौर से देख ले, ये बहुत ज़रूरी है, बहुत इंपॉर्टेंट है और आप लोग एनकाउंटर करेंगे अपने रियल एग्जाम में ज़रूर इसमें से कुछ ना कुछ। तो चलते हैं अपनी वीडियो की तरफ।
Question number 1. As a competent nurse, you are aware that vasodilators are used mainly to treat A. Diabetes, B. Hypertension, C. Atrial fibrillation, D. Hypotension, and the correct answer is B. Question number 2. Which of the following is a potential side effect of 4-furosemide Lasix? A. Drowsiness, B. Diarrhea, C. Cystitis, D. Hearing loss, and the correct answer is D. Question number 3. Which of the following vitamins may not be absorbed properly when giving bile acid sequestrants? A. Vitamin B, B. Vitamin C, C. Vitamin B12, D. Vitamin K, and the correct answer is D. Question number 4. SC heparin should be administered in the A. Flank, B. Abdominal fat, C. Leg, D. Gluteal area, and the correct answer is B. Question number 5. For a client taking drugs to treat peripheral vascular disease, it is important to provide health education about A. Smoking cessation, B. Developing a proper balance between rest and activity, C. Proper foot care, D. All of the above, and the correct answer is D. Question number 6. A pediatric client with asthma has just received omalizumab Xolair. The nurse determines that the client might be suffering a life-threatening effect in which of the following? A. Headache and dizziness, B. Nausea and vomiting, C. Swelling of the tongue, D. Joint pain, and the correct answer is C. Question number 7. The nurse is giving medication teachings to a client receiving theophylline. The nurse instructed the client to limit the intake of which of the following? A. Apple and banana, B. Yogurt and cheese, C. Tuna and oysters, D. Cola and chocolate, and the correct answer is D. Question number 8. A client is receiving sulfasalazine azulfidine for the treatment of ulcerative colitis. Which of the following assessment findings will concern the nurse most? A. Drowsiness, B. Decreased urine output, C. Urine discoloration, D. Vomiting, and the correct answer is B. Question number 9. The nurse is caring for a patient who had an acute pulmonary edema. The nurse should understand that which of the following prescribed medications will help to reduce the increased pressure? A morphine sulfate, B. Potassium chloride, C. Warfarin sodium coumadin, D. Bisacodyl dulcolax, and the correct answer is A. Question number 10. A patient with measles rubella is on airborne precautions. Which of the following precaution techniques would be essential to implement for non-immune persons entering the room? A. Gloves, B. Gowns, C. Face shields, D. Masks, and the correct answer is D. Question number 11. Which of the following is the most common type of cardiomyopathy in children and is treated with medications such as digoxin, lanoxin, and warfarin coumadin? A. Hypertrophic, B. Dilated, C. Restrictive, D. Diastolic, and the correct answer is A. Question number 12. Raymond is reviewing cardiovascular drugs for his upcoming exam. For a well-prepared student, he should know that vasodilators are agents that A. Relax smooth muscles, B. Are used to treat hypotension, C. Stimulate the adrenergic receptors of peripheral sympathetic nerves. D. Cause respiratory depression. And the correct answer is A. Question number 13. A client has been prescribed sucralfate carafate for the treatment of gastric ulcers. The nurse instructs the client that this medication is taken A. 1 hour before meals. B. 1 hour after meals. C. At the same time with an antacid. D. Lunchtime. And the correct answer is A. Question number 14. Which of the following drugs poses the greatest threat to an insulin-dependent diabetic who is pregnant? A. Ritidrine hydrochloride. B. Oxytocin. C. Prostaglandin. D. Ergotrate. And the correct answer is A. Question number 15. A patient who has a diagnosis of multiple sclerosis speaks slowly with long pauses between syllables. The patient is most likely in what stage of multiple sclerosis? A. Prodromal. B. Early. C. Middle. D. Late. And the correct answer is C. Question number 16. A client has been taking ibuprofen for a while and was given misoprostol cytotec. Which of the following is exhibiting the therapeutic effect of cytotec? A. Relief of constipation. B. Relief of diarrhea. C. Relief of vomiting. D. Relief of gastric ulcer. And the correct answer is D. Question number 17. Androgens are medically indicated in the management of all of the following except A. Hirsutism. B. Hypogonadism. C. Metabolic stimulation in prepubertal boys. D. Bodybuilding. And the correct answer is D. Question number 18. A patient recently underwent joint replacement surgery. Which of the following nursing diagnosis takes priority? A. Risk for peripheral neurovascular dysfunction. B. Deficient knowledge on appropriate activity precaution. C. Impaired physical mobility. D. Sexual dysfunction related to pain. And the correct answer is A. Question number 19. Gracie, the mother of a 3-month-old infant, calls the clinic and states that her child has a diaper rash. What should the nurse advise? A. Leave the diaper off while the infant sleeps. B. Use baby wipes with each diaper change. C. Switch to cloth diapers until the rash is gone. D. Offer extra fluids to the infant until the rash improves. And the correct answer is A. Question number 20. Which of the following is a contraindication to the administration of growth hormone? A. The height of the child is under 4 feet. B. The child's age is between 5 and 6. C. The epiphyseal shaft is open. D. The epiphyseal shaft is closed. And the correct answer is D. Question number 21. Vasopressin is which of the following pituitary hormones? A. Antidiuretic hormone. B. Desmopressin acetate. C. Oxytocin. D. ACTH. And the correct answer is A. Question number 22. Which of the following drugs will decrease the effects of vasopressin? A. Digoxin lanoxin. B. Lithium lithane. C. Penicillin pen VK. D. Azithromycin zithromax. And the correct answer is B. Question number 23. Drew is diagnosed with type I diabetes mellitus. As a nurse taking care of the client, you should know that in his condition, A. Insulin is produced but is malformed. B. The beta cells of the pancreas stop producing insulin. C. The client cannot be treated. D. Diagnosis is made in clients over age 50. And the correct answer is B. Question number 24. A physician orders an intravenous fluid of D5Ns at 100 cc per hour. This is an example of which of the solution? A hypotonic, B. Isotonic, C. Hypertonic, D. Hyperalimentation. And the correct answer is C. Question number 25. The nurse is entering the room of a patient who is blind. The nurse should A. Speak before touching the patient, B. Talk to the patient using a loud tone of voice, C. Ask then patient questions that can be answered yes or no, D. Stand directly in front of the patient while talking. And the correct answer is A. Question number 26. Nurse Kioma is teaching the parents of a young child how to handle poisoning. If the child ingests poison, what should the parents do first? A. Call an ambulance immediately. B. Administer ipecac syrup. C. Punish the child for being bad. D. Call the poison control center. And the correct answer is D. Question number 27. A 28-year-old male is recovering from a moderate concussion following a motor vehicle accident 2 weeks ago, when he suddenly develops an increased thirst, craving cold water. The patient urinates very large amount of dilute, water-like urine with a specific gravity of 1.001 to 1.005. The patient is most likely developing a diabetic mellitus, B. Diabetic insipidus, C. Hypothyroidism, D. Thyroid storm. And the correct answer is B. Question number 28. While preparing to discharge an 8-month-old infant who is recovering from gastroenteritis and dehydration, the nurse teaches the parents about their infant's dietary and fluid requirements. The nurse should include which other topics in the teaching session? A. Safety guidelines, B. Preparation for surgery, C. Toilet training, D. Nursery schools. And the correct answer is A. Question number 29. Patrick, a healthy adolescent, has meningitis and is receiving IV and oral fluids. The nurse should monitor this client's fluid intake because fluid overload may cause A. Dehydration, B. Hypovolemic shock, C. Cerebral edema, D. Heart failure. And the correct answer is C. Question number 30. Patient has swelling on both legs. To assess and diagnose this, which of the following I should do? A. Auscultation, B. Palpitation, C. Inspection, D. None of the above. And the correct answer is B. Hope you guys enjoy the video. Don't forget to subscribe.